Alright guys, I just wanted to do like a short video here kind of going over and highlighting some of the actions of methamphetamine and how meth is kind of different than other drugs, particularly other stimulants, and what kind of separates methamphetamine as far as its neurotoxicity and how it works in the brain. So let's get started. The brain produces a chemical I'm sure you guys have heard of called dopamine. Dopamine is in essence the feel-good neurotransmitter. Okay, so any kind of pleasurable activities, we produce dopamine, right? So hanging out with a loved one, walk in the park, sunshine, all that kind of stuff, we get a dopamine spike. What methamphetamine does is it causes huge dopamine spikes, therefore very euphoric, right? Very stimulating because of that neurotransmitter, right? Dopamine is a neurotransmitter. We get lots of neurotransmitter activity. We're going to have the stimulation. So the thing that separates methamphetamine apart from other stimulants is its mechanism. So meth is a little different in it does not actually come out in and out of the neurotransmitter properly, and I'm going to put up an illustration here in a minute and kind of explain it to you. But methamphetamine actually goes into the cell through a process called active transport, and I'll illustrate it here in just 1 second. And what happens is the methamphetamine actually goes into the neurotransmitter disguised as a dopamine molecule. So it's almost like going to work every day in a 2014 Altima. It's white. Let's say your Altima breaks down, right? And you've been going through the same security gate in the same car for 5 years. The guard knows you. All is well. You get a rental car while your car's in the shop. You drive to the security gate. The guard sees you. You got the same color car, 1 year model different. He goes ahead and waves you through the security gate. So you're in. And that's what dopamine does. And methamphetamine. It goes into the cell disguised as dopamine, fits in that little active transporter, gets into the neuron. But let's say you're driving into the security gate at work, and then you got to go through another special entrance, right? And that one, it's actually got to scan the license plate on the back of your car. Well, your license plate is not going to allow you to get in to the garage, right? That's what the storage vesicle is. That's what I call it. It's kind of a garage. So anything that goes into that cell is going to need to be garage, right? Not exposed to the elements inside the cell. So meth goes, sneaks inside of the cell, and it is unable to get into the storage vesicle because it does not got the license plate. So in essence, it doesn't really fit, so it gets stuck outside the cell. So what the cell does is it says, I'm getting a lot of dopamine buildup here. There's a lot of dopamine buildup going on inside the cell. What I'm going to do is take my dopamine stores I got in my garage, right, the storage vesicle, and I'm going to dump those out in hopes of taking some of that dopamine that's built up in the cell and releasing it as well. The problem is the dopamine rushes out, and that's where we get the surge, your stored dopamine, right? But the other dopamine from the methamphetamine cannot get into the vesicle to get out of the cell. What happens is it builds up, right? And we call that process reverse active transport. So it builds up so enormously that it actually gets pushed out of the cell the way it came in. And that's where we see some of the brain destruction from methamphetamine that kind of sets it apart from other drugs. And I got an illustration I'm going to show you right now, and then I'll come back and kind of elaborate on the illustration just a little more. Alright, so what you're seeing right now is that illustration, and it's the neurotoxic effects like I talked about. And in this video you see what I talked about. We see the dopamine that is coming from outside the cell. It's going through that dopamine active transporter, and it can get in there, but it is inhibited if you look going into that VMAT2, right? That's into the vesicle. And what happens is the vesicles are unable to refill, which leads to the buildup there you see inside the cell. Once that buildup begins to occur, what happens is the dopamine that's ungaraged, right? It's not in the vesicle. It's actually exposed to elements inside the cell. And what those elements do is create a separate element called a dopamine quinone, and that element is actually damaging to the mitochondria of the cell, which as we know, the mitochondria is what gives the cell its energy. So the energy is essentially malfunctioning within the cell, right? So the issue with that is the dopamine inside the cell begins to oxidize, and you're getting dopamine pushed out backwards through that DAT. It's supposed to be a one-way gate, right? So it's supposed to go in that DAT there and then go into the vesicle and go out, but instead it's stuck. So we get that oxidation, and ultimately we get that deterioration of the brain. So if you ever heard anyone talk about like meth psychosis or going schizophrenic after, those are the sorts of things that happen with meth use because of that mechanism. Essentially, you're ripping the brain apart from the inside. So when patients ask me what is the most dangerous drug I feel in neurotoxic effects, I always go back to methamphetamine. So I'm glad you guys were with me today. Make sure you like, subscribe, comment. I do this all for free just to educate and get the word out. And please come back for more. I'll do more education. If you guys have a topic or anything you want to hear about, just comment below and I will try to get to it eventually.